So I have an abduction, adduction, So if I'm gonna go into abduction, where do I stand?
Where you are.
Take a look, where do I stand?
On the outside of the leg.
Yeah, you're gonna come this way a little more, but where? Up here, right? Yes, you're right, exactly, because if I stand here, what
The way
happens?
you're
You're in the way.
Yeah.
That's right, so I have to be up here, right? So I'm gonna support one limb, support the other. If I'm doing abduction, I'm gonna support here, but I've got a big stride stance now, because I wanna be able to be in this end position here, okay? So it depends on how much range. So patient position, you're good. I could put something there, but we're okay right now. I'm gonna raise this, because this is way too low for me. So therapist position. Stabilizing hand, which one?
None.
What's the support hand then?
None.
Yeah, there's a support hand.
They say
This
Under
one.
the
This
ankle.
one.
This one.
They both say resistance.
They are adding a little resistance, but this is more support than anything else.
So
Because remember, abduction is, we try not to cross lines. There is a long lever abduction that you can do in side lie that you do cross, and there's good validity and reliability on that. In this position, I'm just adding a little resistance, but more support here, and adding most of my resistance here. Because I'm gonna tuck this up. So I'm over here adding resistance. Think about my body position too. That's difficult. So most of my resistance is here, okay? So now, match my resistance. And we can just slide along. Good. It's okay? I'm watching my patient and good. And we'll match my resistance back. Eccentric, it will match. You're almost pulling it back.
I know.
Okay, so match my resistance. So one of the reasons I know why you were pulling, I'll tell you. That's it. Now back. You feel difference this time. You don't feel the urge to pull, do you? What was the difference? Do you know? Does anybody know?
You're using adductors.
What?
She was using her adductors.
Why? What was the impetus for her to use those?
They're stronger than her abductors.
She's trying to keep her leg from falling.
Watch this again. Watch this again. Okay. Move. Don't match my resistance. That's it. That's it. That's it. That's it. That's it. That's it. Good. Match my resistance. You're having a harder time understanding what you're supposed to do, aren't you? Okay. Now watch. Match my resistance. You caught it.
Oh,
Okay.
yeah.
Match my resistance.
Finger.
Yeah, your
That's
fingers
right.
work
It's my
for-
contact.
Her contact.
Remember, I've taught you about contacts. Where those hands are will create confusion if you wrap on two surfaces. So we want to keep our contact. This is supporting underneath, but I'm not, especially on that eccentric component. When she's pulling that match my resistance back, I can't touch that. That's going to confuse her. She's wanting to resist everywhere that she feels my hand. It's that effect I have on people. Okay.
Edit
So-
that out.
What's that? Yeah, I'll edit that out. Okay, next one. Adduction is the same thing. Where's my hands go for adduction? ADD.
Inside.
So could I do this way? I could, or more likely I could do this way more appropriately. Yeah. So it's the same thing. So we're not going to go through that. You can go through that on your own. Just the hand contact changes. What else?
External rotation.
External,
Good.
rotation.
Internal, external. So your book has prone for one and supine for the other. You can do them both in the same position.
Shows both in soup.
I put the brackets. That's me. I added those. The picture only shows the one. Okay. So internal, external rotation. We have to. I want to have her limb supported. Okay. So we need to do what? Patient position. She has to be at 90 degrees to do this internal, external rotation, right? If I do that, am I getting good internal, external rotation? I'm getting a lot of other component motions there, right? So I have to stabilize. How do I stabilize this?
With your elbow.
With my body. Come towards me a little. Right there. It's my body, right there. Now I'm stabilized. So I'm stabilized here. So if I want to do, what is this motion?
External.
External rotation.
My knees are bent.
That's external rotation. So if I want to resist external rotation, I can support here and I can add resistance here. You have to be careful. Do I do this
Well,
one?
y'all just had that wrong.
Yeah, we did
Internal.
have that wrong.
It's internal.
This is
Raise
internal.
right, raise right,
internal.
raise
I'm trying to
right.
figure it out.
That's internal.
Because it's
I can
correct.
see the tubercle, yes.
Yeah.
I always have to look at the tubercle to say tubercle's going in. So that is internal.
Okay.
So Ray, you're right. Okay, so if I want to do internal in this position, I can do this, but I have to be careful with knees, right? So if she has a knee pathology, is this a good thing to be doing?
Probably not.
Probably not in this way. Internal external rotation regardless becomes a problem if there's a lot of knee pathology. So if I'm going to resist internal rotation, one thing I can add is my resistance can be here if she has a knee pathology. I'm just supporting, right? There. I'm moving her into external. Hence, if she's trying to do internal, I'm resisting, right? So I can go here. I want you to move this way, but match my resistance. Am I adding resistance here? No. If I have knee pathology, I can do that. Relax. Let's do the other direction. I want you to go this way. So I'm going to have to add resistance. I want to turn my body this way to do the reverse of what she's doing, right? So, okay, go ahead, pull it in, pull it in, pull it in. Can you add some resistance? Feel some?
Yeah.
Okay, so I'm really not adding a lot of resistance here. I can, if she has no knee pathologies, it's much easier for me to stabilize here and do my resistance here. So, match my resistance, I'm going to move you into external.
Wait,
External.
I'm going to, okay, sorry.
He did it again, sorry. So we're going to go this way, okay?
Okay.
So you match my resistance. Okay. Match me. You have to add some resistance. Match me. That's it, that's it. More resistance. More resistance, there you go, that's better. Good. Match my resistance. Match my resistance, match my resistance. And now you go push into me. That's it. That's it. That's it. Okay, match my resistance. Okay, yeah? Push back, I got it? Okay, so you can do those. And you can do it from the body here, or if there's no knee pathology, we can do it from here. Does that make sense? As a lever. I'm not going to show you the supine one because it's pretty self-explanatory. That works, or the prone one, I mean, that works really easily as well. You can do both directions prone as well. You can do internal and external. Okay, next.